The question is that the amendment be agreed to. Honourable Member for Moncrieff.
Thank you, Mr Deputy Speaker. Mr Deputy Speaker, I'm certainly pleased to stand up on behalf of my constituents in opposition to Labor's plans to remove the private health insurance rebate. The original bill that's been put to this chamber, which has been argued by both sides for some time now, demonstrates the ongoing way in which the Labor Party, the government of this nation, continues its full frontal assault on ordinary Australians. And of course, the great shame about this particular piece of legislation, Mr Deputy Speaker, the third time it's come before this chamber, is that it is yet another example of the Labor Party saying one thing before an election and doing something quite to the contrary after the election. We know that the Prime Minister has form in this area. We know that the Prime Minister makes all sorts of commitments to all sorts of people and then walks away from them. Springing forth to mind, of course, is the Prime Minister's most significant betrayal of the Australian people when she gave the commitment not to introduce a carbon tax. That commitment, of course, she walked away from as Prime Minister of the nation and now is introducing a carbon tax. The Prime Minister also gave a commitment not to alter the 30% rebate on private health insurance. But again, this Prime Minister has walked away from that commitment. The Prime Minister also gave a commitment to the independent member for Denison and said to the independent actually had a written agreement with the independent member for Denison, indicating that she would move for mandatory pre-commitment. And now the Prime Minister has walked away from that commitment. And of course, who could forget, and certainly the Minister at the table wouldn't forget, Mr Deputy Speaker, that the Prime Minister committed to the former Prime Minister, the member for Griffith, not to challenge for the leadership, and that he had her 100% support, and we all know how that turned out. So, Mr Deputy Speaker, the betrayal of the Australian people with this legislation that's before the House is no different to the betrayal by the Prime Minister towards the member for Griffith. And so, Mr Deputy Speaker, I am certainly pleased to stand here and put unequivocally on the record my complete and total opposition to this piece of legislation, which goes a very long way, to these pieces of legislation, I should say, which go a very long way towards completely ripping out the incentive that Australians have to undertake private medical insurance. Mr Deputy Speaker, I want to talk a little bit about this actual application of these pieces of legislation to my own electorate, to the electorate of Moncrieff. Now, the Gold Coast is a city that's really doing it tough at the moment. We're relying on two key industries, the tourism industry and the construction industry. And both of these industries have been severely and adversely affected by the downturn that's taking place globally. Of course, the pain has been further compounded by the rapid appreciation of the Australian dollar. In fact, the appreciation of the Australian dollar has been a consequence of Labor's heavy debt binge. It's not the sole reason, but Labor's addiction to spending is part of the reason why interest rates have been forced to go up and are more likely to go up than if Labor had gotten the budget under control. That notwithstanding, though, the pain felt by Gold Coasters is very real. They've seen asset deflation. They're seeing increasingly expensive, or I should say increasingly rising costs of living. And for many of them, Mr Deputy Speaker, they're simply struggling to make ends meet. Despite this fact, about 52% of my constituents have private health insurance. In fact, it's 59.8% of my constituents that have private health insurance. Approximately 53,556 out of 70,726 have private health insurance. And Mr Deputy Speaker, when you consider that in my electorate, those in terms of private hospital treatment insurance, some 49,312 in terms of voters, which represents 55% had hospital treatment insurance, and general treatment insurance was approximately 53,147 voters, which roughly is around 59.3% of voters in my electorate. So, in other words, Mr Deputy Speaker, significant numbers of my constituents have private health insurance. And they have it because it's a value proposition. It's a value proposition, Mr Deputy Speaker, because they know that the public system on the Gold Coast, although staffed by very good doctors, by very good nurses, by people absolutely committed to quality public health care, despite that fact, they are forced to endure less than great, let's put it that way, resources from the Queensland State Labor government. So we've got a hospital on the Gold Coast that simply is not up to the task when it comes to meeting the needs of Australia's sixth largest city. We've got a hospital that already struggles with demand exceeding their ability to supply health services. Now, I want to stress again, very committed workers in the public health system. But they're let down by a lack of commitment by the Queensland State Labor government, and they're let down by a lack of resourcing. And now, unfortunately, Mr Deputy Speaker, they're also going to be let down by the federal Labor government, who's walking away from yet another commitment. Why, only today, in today's Gold Coast Bulletin, there was an article, Mr Deputy Speaker, talking about, and I'll quote, the 73-year-old woman who turned up at the hospital. 73-year-old woman was to have her gallbladder removed at Robina Hospital on Thursday when staff told her the surgery had to be cancelled because of emergency cases and a lack of beds. The woman, who did not want to be named, arrived at hospital at 7:30 a.m. and was prepared for surgery, but it was cancelled and she was discharged at 10:30 a.m. A senior doctor told the Bulletin, that is the Gold Coast Bulletin, the Gold Coast Health District was on a code yellow on Thursday, which meant there were no beds and services were overwhelmed. Yesterday, District Chief Executive Dr Adrian Nowitzki denied the hospital was on a code yellow and would not comment on how frequently the code occurred. However, the senior doctor said the code was experienced sometimes 3 times a week on the coast. So we see, Mr Deputy Speaker, from just the most recent news article, today's news article from the Gold Coast Bulletin, that the Gold Coast is a city that already has a public health system that is groaning under the stress of a rapidly growing population and a lack of resourcing. And to think, Mr Deputy Speaker, that under Labor's U-Butte brilliant plan that's before the chamber tonight, that what they're simply going to achieve is to push more people from the auspices of private health insurance into the public system, you are left to wonder, does this government really have any idea about the actual repercussions of the decisions it takes? You see, this decision is being undertaken in an attempt to claw back money. This is the federal Labor government's policy initiative to try to do something to rein in their debt and deficit. But the problem, Mr Deputy Speaker, is that these measures wouldn't even be necessary if it hadn't been such a rampant and reckless level of public spending and waste by this government over the past 3 years. To think about the billions of dollars that have been wasted on pink bats, the billions of dollars that have been wasted on the school hall build, overpriced buildings, many of them charged out at 2 or 3 times what it actually would have cost to build similar equipment and similar infrastructure. When you consider the money wasted on the solar program and the blowouts on Fuel Watch and Grocery Watch and those kinds of initiatives, then you'd realise, Mr Deputy Speaker, that the Australian people have a very genuine reason to be angry with the Gillard Labor government. Because the Gillard Labor government wasted all this money, $900 cheques to dead people, blowouts in the cost of the pink bats, putting them in and then taking them out again. And now they're forced to pay the bill through higher insurance premiums as a direct consequence of the bills that are currently before the chamber. And I've got to say that I stand alongside those Gold Coast families, Mr Deputy Speaker. I stand alongside Gold Coast families who know that they do not deserve this. As a coalition, we were committed to making it easier for people to have choice when it came to private health insurance. It was a coalition government that introduced the Medicare safety net. It was a coalition government that introduced the 30% rebate. And we did these things because we were able to manage Australia's economy well. We paid off all of Labor's debt last time. We got unemployment down. We were able to reinvest the dividend socially of good economic management to make sure that Gold Coast families and all families across Australia were in a better position to enjoy the benefits of solid economic stewardship. And now they have the contrast. They have the contrast of what happens when you have a government that has $50 billion deficits, that blows $136 billion of public net debt, of a government that's borrowing in excess of $100 million a day to feed its spending addiction. Now they face the consequences of a Labor Party that is simply out of control when it comes to fiscal discipline. Now they pay the price of seeing premium increases of 13, 43% across their private medical insurance as a direct consequence of Labor attempting now to do something about their level of debt and deficit. The most concerning part of all this, besides the betrayal of the Australian people, despite the fact that the Prime Minister said that she wouldn't introduce this policy but now is that the government isn't even being upfront and frank with Australians and with Gold Coasters with respect to the impact of this policy. The government-owned insurer Medibank Private has predicted that 37,000 of their members alone will drop the cover and 92,500 will downgrade their level of cover. When you consider that the Minister has claimed that the impact of this policy will be only that 27,000 people will drop their cover across the entire sector, you start to realise, Mr Deputy Speaker, that there isn't a level of being frank, of being fair income with the Australian people and with Gold Coasters. Now, Deloitte analysis of these changes that Labor is implementing show that in the first year, 175,000 people will be expected to withdraw from private hospital cover and a further 583,000 to downgrade. Over the next 5 years, it's expected that 1.6 million Australians will drop their cover and 4.3 million Australians will downgrade. So for the Gold Coast, Mr Deputy Speaker, for a city that is Australia's 6th largest city, a city that 3 times a week doctors are saying is experiencing a code yellow in its public hospital system, we have the U-Butte brilliance of the Australian Labor Party making policy changes to claw back money that they could have not, that they wouldn't needed to have done had they not spent so much money to begin with, actually now driving tens of thousands of people in my city alone from the private system to the public system. And when you've already got a system that's groaning under the weight of excess demand, we can only speculate what it will mean. I know what it will mean, Mr Deputy Speaker. It will mean that people will lose their lives. It will mean that people will need to have access to life-saving surgery and they won't be able to get it. It will mean that people who could have had surgery earlier, had there been more people in the private system, will now be shunted further back down the waiting list as other cases go before them. And the consequence of that, the very real consequence of these changes, are that people will lose their lives. That's what these changes mean, as people are no longer able to avail themselves to elective surgery because they've got to make hard decisions about what they're going to pay for out of a very finite level of income. Gold Coasters, Mr Deputy Speaker, are doing it tough. This is not about the elites. This is not about the rich. The Labor Party likes to play those class warfare games because it suits their arguments. But this is about ordinary working families in suburbs like Ashmore and Nerang in my electorate, Mr Deputy Speaker, people that are struggling already. Suburbs like Southport and Mermaid and Miami, struggling to meet the rising costs of living and being forced to choose between maintaining their private health insurance and paying an extra 10 or 13 or 15 or 20 or 30% more, or letting their cover lapse and going back onto the public system. And it is a disgrace that the Labor Party puts people in this predicament. They shouldn't have been wasting so much money to now have to try to claw it back by repealing good coalition initiatives, the social dividend that flowed under the coalition as a result of strong economic stewardship. So, Mr Deputy Speaker, I stand alongside those 59% of my voters, some 53,500 voters that live in my electorate that have private medical cover, who I know remain steadfastly opposed to this initiative by Labor. They're not all millionaires, Mr Deputy Speaker. They're not all exceptionally wealthy. They're just ordinary Gold Coast families. And they're going to have to pay more now because of this Labor Party policy. And it's a great shame that they're forced to be in that situation because this government does not have the wherewithal to get their debt and deficit under control. Because this government is seeing $1 billion blowout in the cost of our border protection, is seeing $1 billion blowout in pink bats, is seeing massive blowouts in school halls and solar programs and Fuel Watch and Grocery Watch and all of these kinds of harebrained initiatives, Mr Deputy Speaker. Money which could have been saved which would save lives because we wouldn't need these kinds of policy initiatives that the Labor Party is taking.